Okay, we are talking about respiratory topics. So let's review a little bit about respiration. Everybody probably knows this. You remember it from pathophys and A&P, but basically the function of respiration is to bring in oxygen and oxygen for all our systemic organs. The other thing to do is we want to eliminate our CO2 from the blood to the outside. So everyone remember that your number one mechanism for breathing, when to take more breaths, when to breathe deeper, why we breathe faster is as our CO2 goes up, that's a mechanism for us to breathe more, to breathe off our CO2. The second mechanism is your H ion, so acid basically. So when your pH goes lower, more acidic, more iron ions, then that also causes an increase of respiration. So let's talk a minute about epistaxis. Epistaxis is a fancy word for a nosebleed. We all have nosebleeds now and then, some more than others, and usually they always stop. So if you have a patient that their nose will not stop bleeding, then things to do, it's pretty basic first aid. Put the patient in a sitting position. You hold pressure on the soft part of the nose, or if that doesn't work, you can insert gauze and continue to hold pressure. If it ends up going to the doctor or clinic for treatment, they could cauterize the inside of the nose, or to help, they may put what's called pledgets in the nose. Those are basically nasal tampons. Wouldn't feel good, but here we go. Let's stuff the pledgets in the nose and stop the bleeding. So sinusitis for a minute. Sinusitis basically is brought on by it's usually a viral issue. Someone that has sinusitis, things you would teach a patient is drink lots of fluid, 6 to 8 glasses a day. More fluid, more hydrated you are, mucus becomes more, it's not near as viscous and thick, so it's easier to get out. You shouldn't use decongestants longer than 3 days. It dries out and may cause more problems than you started with. Also, a lot of decongestant itself could cause bleeding. Antihistamines you use with caution, although a lot of people take them. That's also going to dry out your mucous membranes and cause more viscosity in your mucus, so it's harder to get out. You can buy nasal saline solutions from the store. Those work, or you can make your own. So there's a recipe on making your own. Use a spray bottle and spray up into your sinuses through the nose 3 times a day. If it doesn't help, then the patient can either live with it or they can have surgery to fix it. So, pharyngitis. Sorry, it's getting away from me. So, pharyngitis. Pharyngitis, we all know, it's basically a fancy word for a sore throat, so it can be on any part of your tonsils, palate, uvula. It's either bacterial, fungal, viral. Most of them are viral. Most common, or the worst one, is B. hemolytic streptococcal, so strep throat. Remember, strep throat, if it's not cured, can cause rheumatic fever, or it can attack the valves in your heart or cause glomerulonephritis. So strep throat is not something to prolong and not get treatment for. You do need antibiotics for this. The problem that a lot of people have, because that's what we do in our culture, is anytime we're sick we want a medicine. So viral usually goes away. So viral treatments, whether it's a cold or it's a sore throat, bacterial antibiotics do not work, but people like to take them, and that's what's causing a problem in our country where antibiotics are just not working for as well as they used to. People are getting strains and it's not it's not working. So if it's fungal, you could do nystatin, swish and swallow. If you are using corticosteroid spray, you need to be careful because if you don't rinse your mouth after spraying corticosteroids in your mouth and throat, then it would cause candida. So you need to make sure you do that. So neck cancer, really carefully. Neck cancer, number one thing that's caused by that is obviously smoking, chewing, cigarettes, cigars, snuff. Any kind of tobacco use is the high risk for any kind of neck or oral cancer. The big issue with someone that goes through treatment is they're going to have radiation. They're going to have what's called xerostomia, dry mouth. So here are things to do and tell the patient to help them. And it's usually permanent, so that radiation will kill the parotid glands and the patient will be low in saliva forever. So carry bottled water, sugarless candy or gum. Medication called pilocarpine hydrochloride will increase your saliva, so sometimes that works. So influenza. What is influenza? Well, it's basically the flu. It's usually viral. That's why we get flu shots. You all get flu shots every year. I get one every year. Contraindications for a flu shot is if you've had Guillain-Barré or if you have a sensitivity to eggs. We really need to advocate for patients that are older than 50 to get a flu shot. Other people in that category, healthcare workers, people that have low immune systems, people that have cancer, HIV, anything that's causing low immune problems. So we all know signs and symptoms of influenza because we've all had it. Medications, if you use the antivirals, the most common one is Tamiflu. Tamiflu, though, has to be started within 48 hours of exposure to work. If you take Tamiflu after your full-blown symptoms, it's not going to do any good. A lot of patients take Sudafed. It's a great one, but if you have heart problems, you don't want a faster beating heart, so that might be an issue for those patients. So tracheostomy. You've all practiced trach care in skills lab. So tracheostomy is usually for long-term ventilation. You can't keep the endotracheal tube down the throat for a long period of time. So we make a trach and we put the tube right down into the trachea. It's also, once we do that, the patient can learn to speak and take oral intake with the trach. Because the trach is inserted straight into the trach, it's not going into the esophagus and it's lower down. They can easily take fluid and oral intake with the trach. So all trachs, you know, have a faceplate, a flange, which rests on the neck. And not all of them have that inner cannula that you are probably familiar with in skills. If you have somebody on trach that need to be suctioned because of fluid, here are the things you need to remember. You always wear goggles, and gloves would be good because it's a sterile procedure. So sterile gloves and goggles. The pressure on your suction should be no more than 120 to 150. No more than that. You don't want to cause injury to the patient. The other thing is sterile procedure. You need to pre-oxygenate the patient before you do that, so make sure they have plenty of oxygen. Turn it up really high. Usually if you're doing this even on a ventilator, they get oxygenated at 100%. You insert the catheter. You do not suction while you insert. And then when you remove it, you rotate it and suction intermittently, hitting the hole on the suction. So it's not continuous, but, you know, off and on, off and on. You never suction more than 10 seconds at a time. I mean, suction for 10 seconds. The way I always do that is I would hold my breath when I start to suction, and 10 seconds is a pretty long time, so if I can't hold my breath, you know they can't hold their breath that long. So when you're changing trach dressing, the ties around the head to hold that, it's usually a two-person operation, so don't try to do that yourself. The great thing about